Serious. Doctors of Reddit, what's that one case that made you go I'll never see that again? Inflated like a balloon from the hand. She worked at a machine that made plastic bottles. A hollow spike with a blob of melted plastic is jabbed into a mold and it injects air until it reached a preset cutoff pressure before the mold opened. While cleaning the machine cycled and caught her hand. The spike kept injecting air, but never hit the cutoff pressure, so it kept injecting. Fortunately it didn't hit a vessel that would kill her. Instead the air dissected in the fascial planes and subcutaneous tissue and blew her up, free air in abdomen. Both lungs partially collapsed, looked like a volleyball. We re-inflated her lungs with chest tubes, gave her antibiotics, but she was fine otherwise. The rest of the air absorbed over a few days. Saw her in the office and she was a tiny thing, unlike the huge obese person I had suspected on discharge from the hospital. I think one of the most interesting things I ever saw in the emergency department was the opposite of an episode of Untold Stories of the ER that I literally saw a few days earlier. The patient in the episode is labeled as being acutely psychotic because she said something was crawling in her head. The doctor listens to her story and indeed believes his patient to be acutely psychotic. It was the physical exam that revealed that the botfly laid eggs on her scalp and they had to remove multiple insects from her scalp by using Vaseline to suffocate the bugs enough to extract them. My patient unfortunately had the opposite. She was a highly respected member of the community. She went on a holiday and got worms in her vagina. The gynecologist confirmed it for her under a microscope. Once the diagnosis is made, you are easily treated. She was given the requisite dosing of, I think, mebendazole. This is a one-time dose and sometimes you need a second to cure yourself 2 weeks later. Unfortunately, what the patient presented with was an acute psychotic break. She stated she had worms coming out of her skin. The only way to get them was to chew walnuts and rub the chewed walnut paste against her skin to extract the worms. She rhythmically rocked in the bed while her husband sat by. She couldn't stop rubbing walnuts and saying, "See, there's a worm." This went on for hours while we ran lab work, CT scan of her head, drug screen, even sent walnuts worms for pathology. No positive results. Eventually I had to admit the patient. The husband looked so defeated. I didn't feel comfortable with him having the strength to care for her. Don't know if I'll see that scene again. Women managed to mistake fake fingernail glue for her eye drops on her bedstand. She glued her eye shut. And yes, I somehow saw it again. Edit. The patient, we eventually eased it open using petroleum jelly and some simple tools, cotton swabs etc. Once open, her vision was unaffected. Thank G. And her kids berated her mum such an idiot. The petroleum jelly is not an antidote but just a way to lubricate while we safely, slowly pried. Second patient who had it, a little kid with even more glue, so it was a scarier event. The eye wasn't totally shut, so we knew tears could get through, which means no chance for blockage. In that case, we were unable to open, so we provided an eye patch and said, "You're a pirate now." That last part isn't true. In reality, they just had to wait the few days till the glue wore away and the body generated new skin below, kicking off the old skin with the glue. The child was okay in the end as well. 70-something-year-old lady at normal health, walking, reading, enjoying life with husband, a month or so prior to arriving at the university hospital where I was a resident. In that month she had rapidly went blind, vision was first symptoms, optometrist said everything was good, and no longer spoke nor ate. Husband distraught, obviously. Diagnosis of sporadic Creutzfeldt-Jakob disease. The human version of mad cow disease or scrapie. Had this 36-year-old woman come in on a wheelchair, was over 300 plus pounds she hadn't gotten up in literal months, and her family was giving her food, water, etc. She tried getting up and according to her immediately fractured right upper leg, and left ankle. From the looks of it, it seemed like they had already been like that for a while, that they healed in their broken state. She finally admitted to trying to break them again because of the pain, so had her kids ram crap into her. She had food wrappers shoved into cuts on her arms to stop the bleeding and had full cataracts in both eyes. 3 of her toes were completely black on the right side. Honestly, I was just amazed to see her not screaming from pain like dumb. Edit, back to answer a few questions. The cuts didn't look deliberate, as some were places she couldn't reach. Also, the wrappers were from some hot dog place that I can't remember at the moment. The wrappers weren't fully inserted. Nearly every cut was fully healed as it could be anyways, with wrappers still there. She did have type 2 diabetes as well. No, I will not name her due to privacy issues. Had a guy bouncing around clinics for probably years if not decades with non-specific back pain. It affects millions of patients, so the typical thing is, rest, stretch, ice, maybe over-the-counter meds and go about your life. Well, when he got to us he mentioned he never had any imaging. So we do just a regular x-ray of his back. Sure enough, there's a small caliber bullet lodged near where the rib meets his spinal column. Apparently he had been near a drive-by shooting decades ago and was shot, but thought he just cut his back while jumping over something to get cover and never had it checked out. Never had expected an incident bullet, probably never see one again. Nurse here. Got a patient from the ED. While she was down with the nurse noted that her shirt was wet. She was assisting the patient into a gown, and when she removed the shirt there was an open stage for breast tumor there. The wound's about the circumference of an apple or orange. The doctor asked her, "This doesn't just happen overnight. How long has this been going on?" The patient had no idea. This woman was definitely weird but didn't appear to have any psychiatric diagnosis. She lived with 2 brothers who obviously didn't have any reason to be looking there. She's probably dead now. A good friend is doing residency at a pediatrician's office that had a 6-month-old girl brought in because she had started growing public hair. Not fuzz, straight up pubes. A nurse took note of the fact that the father was in his 60s and had enough insight to ask if he was taking testosterone treatments. Turned out that during skin-to-skin time he would lay his daughter on his chest, in the same spot he had applied his testosterone gel earlier in the day. I'm a medical student, but I have seen 2 cases that I don't think I'll see again. First was a woman with Fraser syndrome. Basically, every time she chewed, a small area on her cheek, right in front of her ear, would start sweating a lot and get red. The other one was a middle-aged man who got stabbed by his wife. It was actually the second time that he had come to the ER for being stabbed by his wife, and apparently his son had stabbed him once before too. He defended his wife by saying, "I made her mad," and refused to take legal action against her. Some years ago we had this patient that was diagnosed with breast cancer at an early stage, pretty treatable. She wouldn't even need a mastectomy, just a lumpectomy plus radiation, not even chemo. Well, after some advice she got from some holistic healer, she backed up on the surgery and refused any treatment since her healer had told her cancer is the result of keeping a grudge on things and medical treatments were a scam that work eluded the big pharma. Her whole care team tried to put some sense in her head to no avail. Even the head of surgery tried to convince her. The social workers, the priest of the hospital chapel. She said no. Fast forward a year and a half or so later, she comes back to the ER, a terrible fever. The smell gave it away. Her breast was no longer there. It was just an open, bleeding mass producing pus maggots in it. She went to the ER after her husband begged her for it, She was still convinced her healer could cure her. Scans showed it had spread everywhere. She passed away a month later. She was 35 and left 3 small kids and a heartbroken husband behind. Locked-in syndrome. Paralyzed, unresponsive, could only move eyes, vitals and scans all normal. Shipped off to a big hospital with a neuro ICU. Haven't gotten a follow-up on her. Only 35 years old. Neuro ICU nurse. I've cared for 2 people with locked-in syndrome over my career. One young man due to a rapid overcorrection of sodium during surgery, and the other a young woman who had a hemorrhagic stroke from high blood pressure, then had an embolic shower that stroked her pons preoperatively. He partially recovered over months and months, but pretty much lives like an incomplete quadriplegic now. Needs full-time home care. She could only move her eyes straight up and down. She communicated with us with a letterboard and moving her eyes up, down for yes, no for more than a year before deciding she couldn't live like that and decided to have physician-assisted death. Thank you for watching all the way to the end. If you were at all entertained, please consider giving this video a like and subscribing for future content. Stay safe everyone, until next time.